Hi, my name's Imelda and I'm the Patient and Public Involvement Coordinator for the Vascular Research Team at University of Leicester. In my last video, I spoke about what patient and public involvement, or PPI, in research was. Today I'd like to talk about why patients get involved in PPI, why researchers need them to, and how important this really is. So, why should you think about getting involved in PPI? Well, the current participants on our vascular research registry tell us time and time again that the reason they're getting involved and the reason they stay involved is to try and help patients like them in the future. Of all the other motivations and reasons they come forward with, this is the one single thing that everybody says. They want to help people like them, or people like their family members who may have a condition. And that's really profound. That's really meaningful and impactful. Researchers, when asked why they need PPI, give a similar answer in a bit of a different way. So they also want to help patients coming into their clinics, patients coming into the hospitals. They want to answer the unanswered questions and find out the best possible future treatments, medications and procedures for patients who are struggling with conditions. We do have a problem within patient and public involvement in vascular research and in research across the board in the UK, and that is this. To be certain that the results of any research study that we do are valid to everybody, we have to get as many patients as possible from as many different groups of patients involved as possible. So we need to be getting people involved in research who are of all ethnicities, of all races, of all abilities and disabilities, of all ages, of all genders. We need everybody, as many people as possible, to get involved in research studies so that when your loved one comes in a few years' time with a condition, we will know that the results of our research have shown that the medication or procedure that they're prescribed is going to be valid for them. Chances are very high that that's the case. But we don't have many people from some groups involved in this PPI process where we design the research. And there could be all sorts of reasons for that. But the problem then means that we're not identifying, reaching and getting involved with the groups of patients that we actually need to be coming forward and taking part in research, because we don't understand what the barriers may be that they are facing. The only way we can find that out is through focus groups before the research projects are rolled out, so that we can understand how to design the research projects to be as inclusive as possible for everybody. So that is why it is really important that you can get involved. Even if you feel like you don't have anything to add to the conversation, even if you feel that your experience really doesn't matter, nobody wants to know about that, it's not that important, it might be more important than you think. If we don't hear from you, we can't hear from the groups that you represent, whatever they are. So your voice does matter, it is important, and we do need to hear it. And that's why you should get involved, so you can improve treatments for patients like you in the future, for like the people you love.